they think already that this condition, epilepsy, it's because, like a punishment of the gods, or like, like demons and witches and all of like supernatural things. And, unfortunately, we still have these beliefs.
Imagine having to translate everything about epilepsy in detail into 68 languages just for one country. And you need to work with patients, families and communities who believe epilepsies are due to punishment from a god, demon, witch or other supernatural creature. Well, challenges like these are way more common than many of us realise, especially in low to middle income countries such as Mexico. Today, Yanin Rivera from Mexico tells us how she is challenging all of the aforementioned in her country through education, community work and telemedicine. If you haven't done so already, please like and comment on this episode and subscribe to our channel so that we can get way more people around the world learning facts about the epilepsies.
I am Yanin Rivera and I am from Mexico. I am pediatric neurologist and I am working in a hospital, like at second level here. The name is Hospital Regional Tlalnepantla. I am looking patients with epilepsy, and this is my job, to see kids and all kind of patients, but from the childhood to adolescents with epilepsy. And we are already preparing everything to be a reference center of epilepsy here in Mexico City.
So what is access to care for people with an epilepsy like in Mexico?
We are 2,000 of neurologists, but we are only 600 pediatric neurologists in Mexico. But most of us, we are living here in the city. So the access is very limited in the rural areas.
So tell us about the demographics of people in Mexico and how is that related to the epilepsies?
We are a very crowded country. We have 130 million people living here. And the poverty here, it's so much. It's like 7 million people. They are in poverty, but in extreme poverty, like 9% of this. So we have very limited resources in health with these extreme poverty people. So they don't have enough access to get opportunities to attend all the conditions like epilepsy. And the thing here is like we need it. We need to be doing more access the health to them.
Can you tell us why people who are living in poverty in Mexico are more likely to actually have or develop an epilepsy, please?
It's because they have like very limited education and they don't know how to be taking care, like in special of the pregnancy. So they don't have enough access to the information. Some of the patients that we detect with epilepsy, it's because they don't have like a good pregnancy. Like all the antenatal factors, they don't have very good control, and that's why the encephalopathy, hypoxic ischemic encephalopathy at the birth, it's a very common etiology of epilepsy here in Mexico. And the lack of education here is playing a very important reason to have very high numbers. So if we have prevention and we have education in mothers, so we can have, reduce the numbers in epilepsy. If we are checking the etiology, like all the causes of epilepsy here in Mexico, we have number one, like the structural things that like dysplasia, agenesis of corpus callosum, and all of the structural things that cause epilepsy. And in the second number, it's this one, like all about the asphyxia, birth asphyxia. Um, and the third is brain injuries, trauma, because the people it's having this risk in especially in the rural areas that they don't have enough access to arrive to medical attention after they have accidents. And then we can say about the brain tumors, infections like metabolic or genetics. We don't have too much access as the high income countries to do the genetic things. We already know that it's important to have a accuracy in the diagnosis.
How do cultural beliefs and perceptions affect some people's approach to a diagnosis of epilepsy or treatment of an epilepsy?
Here in Mexico, there's a lot of rural areas still, and most of the people, they don't want to have medical attention because they think already that this condition, epilepsy, it's because like a punishment of the gods, or like demons and witches and all of like supernatural things. And unfortunately, we still have these beliefs. uh, it's hard for the medicals to go to the rural areas because also the languages that we have here, it's like close to 17 different indigenous languages. Yeah, it's very hard already to get the information.
That's kind of cool as well. So just to say, that's kind of cool to have so many languages. I was like, whenever I think of Mexico, I think, oh, Spanish language, but it's so much more than that, right?
Yeah, that's we are trying to like do guidelines, but in different languages, like because we are closer that like 68. By the way, now 68 different indigenous language. Spanish here is the natal language, but if the people it's living in these rural areas and they are not having the communication as well, we won't have very good control and already don't have like the how to express how they feel, how they can get the information about the treatments, diagnosis. So we are ready to working on this.
So what is being done to challenge this whole situation and improve the quality of life of people in Mexico, particularly those in the more rural areas affected by the epilepsies?
We have like a priority epilepsy program that it's working like 40 years. Like the last count, it was 93 centers in epilepsy. And it's very important to have this reference sentence in epilepsy because these centers have enough resources, the EG, the MRIs, and they already have the medications. So we are trying to get all of this in a structure in the very rural areas to try to go and educate. Not we are very few, as I said, pediatric neurologists, but we want to educate like the general medical general,
community doctors, general practitioners.
If we educate the family doctors, the practitioners in the community, that they will have the knowledge, like a nurse, like these practitioners. So the main goal of this program is to arrive to the very, very, high town in Mexico and to let them information in epilepsy subjects.
And it sounds good to me because it's you can't create more clinicians overnight, right? So instead you're putting the power into local communities and local clinicians through education. It sounds much more realistic and empowering for local communities too. So, are you involved in an ILAE program?
I am involved in the task force in telehealth medicine. In Mexico, we already have some programs in telehealth, but not as stronger than in North America or in Europe. And the goal is to do a very big program to have this to get close the people. And we are working on that.
But now you can do it on phones, right?
Now you can do on phone, and also you can do in the message and video call. It's very easy to have access. Everybody have a cell phone, a mobile, and it's easier to have control. And we also doing applications here in the mobile cells. Yes, to have this register of seizure and to have better control of epilepsy.
Yanin's dedication, empathy, resilience and stamina, because her work is a long-term game, is really admirable. Now, we are all of the same species, only a few hours away from each other on a plane, so I believe that we need to work together globally to improve the health of our fellow Homo sapiens. Check out more about Yanin at the website torierobinson.com, where you can access this podcast, the video, the transcription of the episode all in one place. And also, if you haven't done so already, please do like and comment on this episode. It really helps us with the algorithms so that we can reach out to far more people around the world. Also, if you haven't yet, please also subscribe to our channel. Share this episode with your friends, your colleagues, patients and families so that we can get so many more people around the world learning facts about the epilepsies. See you next week.